radius. So it's probably, so you're trying to create Olympic rings like this, so that the rings can coalesce with each other and give you a desired result. So this is how the toxin is going to act and give you a desired result. Okay, it's going to work with the
वीडियो में आगे बढ़ने से पहले कृपया मेरे चैनल को लाइक एंड सब्सक्राइब करें।
most important landmark or the soft tissue landmark is the eyebrow. So everything is about the eyebrow. Okay, and there are a few things that I will tell you what I do differently and what is recommended. The recommendation, remember I told you, is lateral limbal line, right? But I don't like to use the lateral limbal line because hota kya hai, when I tell my client to look up, she's looking up and then starting to look on one side, or she's looking towards me. So what has happened is one side my limbus line has moved, the other side my line has come more medial. Okay, so the easiest thing to do is use this point, the eyebrow peak, and use the eyebrow peak. Okay, then ask her to come back, and then draw this line vertically up like that. Okay, and draw this line vertically up like this. Okay, this is slightly gone teda, but on an average this. Now when she sits up, look straight. When she looks straight, see the line corresponds with the lateral limbal line.
Yes.
To most people. Okay, now the next step is I have to ask her to look up as much as you can. Okay, down, one more time. See now what is happening. Relax. Now you will see this portion go this direction, this portion go this direction. Okay, do one more time. Can you appreciate?
Yeah.
Okay, जोर से करना. Okay, see, can you see the scalp move down? And you can appreciate that line where this everything is happening at this line. See again, one more time. Relax, one more time. Harder. Okay, one more time. Can you appreciate it? So what is this line? This is the line of convergence that we talked about. Agreed? Everybody agrees, right? No confusion on that point. Okay, so this becomes my line of convergence and my lowermost extent of what I will do for her. I will not cross this line and I cannot treat any righted below this line.
Right.
Okay, so then how do I mark? I mark my central point. Because it said that for the frontalis, for about 4 centimeters, the frontalis is single convergent frontalis. Normally it will diverge for most people, but for some it can continue as single layer, or if the muscle is central. Remember I showed you 4 different patterns that you need to know. Then my next point is here, lateral, here, and this point is lateral here. Okay, for my female patient I turn the needle inside. For my male patient I go like this. Agreed? Okay, then I look at the hairline's location and I mark the hairline. Look at the hairline's location and I mark the hairline. And from the hairline I go 1 centimeter lower and I mark a point in between these 2 points, here and here. Clear? The lateral point. Now for a male client, they don't like the peak to arch, but a female wants it arched. So for my female patient, the needle is being turned inside because I don't want to touch. So where is the lateral crest? The crest is here. So I am sparing these fibers of the frontalis so that they can act and lift the arch and cause the arching. But I also want the peak to move. So I use the peak as a reference, but I directed the needle away from these fibers because the range of diffusion, if you are intramuscular, is going to be like this. And I want to shift it as much that side rather than shifting it this side any which ways. So I'm going to do an M pattern of injection, which is the conventional M pattern for my injection of toxin in this area.
And this point is the midway between
The 2 points, yes. And I don't want to go too high up also because that will be in the hairline, so there is no point, right? So I'm going to put 4 units per point. So this is 4 units per point, and I have done 20 units radius. So it's probably, so you're trying to create Olympic rings like this, so that the rings can coalesce with each other and give you a desired result. So this is how the toxin is going to act and give you a desired result. Okay, it's going to work with diffusion. So your dose is higher. You're putting 4 units per point. The challenge was, if you try, remember the lower frontalis is getting weaker. So if you are above the line of convergence, you are sorted. For a young patient, you can respect the line of convergence or may not respect the line of convergence. But as you get into middle age and higher, you have to respect the line of convergence. So once since the time we have started using the line of convergence as a reference, the problems have been less. So let's look at the glabellar complex. Okay, so we're gonna ask her to frown. Now what you're seeing is, you see that frown ek baar aur. So you see this, right? And then you see frown, and then you see the singes happening here,
Yes.
and then you see a singe happening here, and the bulge happening here. So the oblique belly and the transverse belly of the corrugator. Okay, so how am I going to treat her? Chin up, frown ek baar, frown. You see she's developing a lambda pattern, so she's recruiting the lower frontalis fibers also here. Okay, first point of injection, procerus. Second point of injection, the vertical bellies or the oblique bellies of the procerus. Okay, one more time, frown. So this point is 1 point, second point, 1 point, second point, and the central point. Here I have kept it at the nasofrontal angle because I don't want to go above that, right? I don't know where the frontalis and the procerus will merge. Okay. Also, what I want to make sure is these 2 points are not sitting one under the other. So there is a gap, there is a reasonable gap from this line that I have stayed medial to that line. Again, 4 units per point. 4, 4, 4, 4 and 4. Right? To treat the corrugator complex. So far okay? Okay, so now we have done 20 units. Okay? Right, so that's the crow's feet area. Now how do you treat the crow's feet? Remember, we said 3 centimeter. You can use a scale to measure, right? And mark a point right in the middle, which is 1.5 centimeter. Then you draw a vertical line from that line. Okay, and then mark a 30-degree angle in this direction and a 30-degree angle in this direction. Okay, and then go 1 centimeter here and go 1 centimeter here. So 1 centimeter here and 1 centimeter here, and both these points, this point is you need to be very careful. You don't want to go above the eyebrow because there is no elevator. So this is again the superior temporal crest is here. Here is the superior temporal crest, right? So there is no elevator here. There is only depressor here. You don't know what is the extent of the orbicularis here. So you want to stay here and stay below the eyebrow as much as possible. So if the lines were extending much deeper, you can create another V like this. But then you split the dose 2, 2, 2, 2, 2, 2. If the fibers are coming down here, you can do 1, 2, 3, but you're half the dosing here because you're going closer to the smile. See, when she smiles, relax, smile. This is the origin of the zygomaticus major here. This point. So you are very close. This point is very close to this point, and there is a high likelihood that if you accidentally don't inject here but start to inject here, you are going closer to the origin of the zygomaticus. Okay, so the injection point here, the bevel is always parallel to the skin and you're raising a bleb because the muscle is subdermal and you don't want to go and inject deep. Okay, so I did 4, 4 and 4, 4, 4 and 4, and this is about 1 to 1.5 centimeter away from the lateral canthus. So I did 12 units on this side, 12 units on the opposite side, and I did 20. So that 24 plus 20, 20, that's 40, and 12 and 12, that's 64. The standard technique. Okay, of course, people can tell you that, okay, I will alter my dosage. My suggestion, don't alter your dosage. So when you want to do masseter for somebody, what do? You mark the anterior border of the masseter here. Okay, and then you mark the posterior border of the masseter, which is here. Okay, draw a line from the corner of the mouth to the lobule, as I told you, right? Tragus is what you can also use, but I'd rather suggest and encourage you to do this. Okay, draw another line sparing 1 centimeter of the anterior border. Why? Because the rhizorius is here. Okay, then clench, see where the peak is. The peak is right here. 1, peak is here, 2, and another one is here. So you have to put 20 units. So you put 8, 6, and 6. Okay. Then if you were to do Nephrititi for her, okay, clench your, tighten the platysma. Yeah, see, there is effacement of the jawline, right? So you can improve the jawline. How do you do it? You mark the jawline. Relax, yeah, mark the jawline. And this is the anterior extent, so don't cross this. Okay, this is the angle. There's no point going beyond the angle also, right? So you start from here. I'm going to change colors so there's not as much confusion. I'm going to do 1, 2, 3 above the line. 1, 2, 3 below the line. Okay.
Same as the masseter.
Yeah, but this is platysma. Masseter is a deep muscle. This injection is supraperiosteal, intramuscular. This injection is subdermal. So it's a different depth. Okay, and then look for the posterior platysmal band. Tighten. See if there is a posterior platysmal band. Here, there is a posterior platysmal band. Grab the band and put. So if the band was here, you grab the band and you put 2 points here, 1 and 2, and put 2 and 2 units here. You can put 3 also as per your liking depending on the band. So 2, 2, 2, 6, and 2, 2, 2, 6, and 2, 2, 2, 6. 6 these are 18. So 18 units you put each side. That's Nephrititi. Okay. You can also do the D. Okay. So when you have to do the parotid, again the parotid is not there, but if you are doing the parotid usually is sitting. This is the arch, lower border of the arch. The parotid is sitting here. And you can see a little bit of bulge in this area. So this is the territory of the parotid. Okay. So if you want to inject the parotid 1, 2, and 3, 5, 5, 5 into the parotid. Okay. Again, she's got a hyperactive mentalis. See this, how the mentalis is strong. So you mark the postlateral extents of the mentalis. Relax. Then you mark the midline. Okay. And then 2 units and 2 units on either side of the midline for the mentalis. Okay. The DAO. Okay. And the masseter. Okay. Right in the middle. Here. 2 to 5 units needle directed in this direction. So you're always going away from the DLI, which is here. Okay. One more indication that you will do is nasalis scrunch.
This is also subdermal only.
This one is subacute to subdermal. The muscle is subacute. Okay. Nasalis, how is the nasalis aligned? Arises, relax, arises from the common origin here, inserts into the midline. So these are the fibers of the nasalis. Okay. So if you are going to treat bunny lines or scrunch, okay, so scrunch lines, this is the bulge. Treat it here. If you're going to treat the flare, smile, see the flaring happening here a little bit. So the fibers are also going in this direction. So ideally you should be putting it here, but it's very painful there. So what I like to do is put it here only at the origin. So for both the indications, my treatment is the same as if I come closer to the origin, I treat both the fibers, the transverse also and the oblique fibers also. Gummy smile correction. She's got a gummy smile, so that's why she's a good candidate. Smile, smile, smile hard. See the gummy show. Now, do you treat her gummy smile? Technically, no. Why? Because she's got good quality gums. But if the gums are irregular, then you have to treat the gummy smile. Okay. So where do you treat the gummy smile? Couple of techniques of treating the gummy smile. First, see what happens to the levator labis superioris aliquot nasai, which is here. Smile. See how much is the pull, right? But the bulge is happening here. So mark your point right at the peak of this triangle. You see this triangle that is getting created? At the peak of this triangle, you mark that point. It's also the common region of the nasalis. Okay. So at that point, you put 2 units here and 2 units on the other side. Minimum. You can go up to 5 units also. What you also do, lift up, you mark the filter column. The filter column would be here and the filter column would be here. And then on either side, you can do a lip flip also along with that. So you put 1, 1, and 1 unit here, here, here. Each point. Okay, but here you'll have to be careful. Because why? In trying to treat so what is happening with the levators are inserting into the skin. So when you're relaxing here, you're relaxing the lateral levators. But for most gummy smile corrections, smile, the gummy pull is in this midline here in this area. It's not as much as here. Here what you're trying to do is the in-rolling that is happening with the lip. So that lip is becoming thinner when she's smiling. So if you want to give her a lip volume, relax, you are going to turn this lip out like that. Okay, and then you can put a little bit of filler in the lip to give her a lip volume. Okay, depression is eye septi, smile. Okay, so some people, not her as much, but some people can take the tip of the nose down when they smile. Okay. Yes, so to relax that, it's called a parrot beak deformity. So every time they smile, that beak goes down like that, right? Parrot beak deformity. So if you have to correct that, the muscle that is pulling is depressor is eye septi. Okay, that muscle is actually very tricky muscle. The muscle is arising from the incisive fossa here and coming up into the septum and the tip, and it's traveling in this. Sorry, I'm not doing anything. Just it's in this area. So you have to go deep here on the bone and inject 2 units here and 2 units on either side. But it's a painful injection.